Welcome to this next edition of the three healthcare things you need to know from Tallahassee. My name is Fraser Cobbe. I'm super pleased to be with you here at the end of the third week of session. And I appreciate my partner in crime here, Joe, down in and helping us deliver this update for all of the physicians and the associations that we represent on what's been going on the past week up in Tallahassee.
Yeah, Fraser, it's good to see you again. When we talk each week, it means it's Friday, so that's exciting. I'm Joe Daraskevich, and a lot happening over in Tallahassee this week, Fraser, including a trip. You guys were up there again.
Yeah, it was a busy week. Did want to give a shout out to those doctors that were able to make it up to Tallahassee to help knock on doors with us. We had doctors from the Physician Society of Central Florida, which is actually a regional group there in the Orlando area, comprising of doctors from Orange, Osceola, Lake, Seminole, and Sumter counties. So they were up at the start of the week, and then we had some movement, which we'll talk about later on workers' comp. So we had a couple of our orthopedic surgeons come up as well. Our current president for the Florida Orthopedic Society, Kevin Schrock, came up from Fort Lauderdale, and then later in the week, Larry Halpern from Orlando did a last-minute turnaround adjustment of his calendar to drive up and help us on Thursday too. So there's a lot to talk about this week, actually. So I'm excited to dive into it with you.
Yeah, last week was exciting as well, and it's always great to kind of see how everything happens up there, in Tallahassee. You get a chance to go visit. Well, let's just dive right in. Like you said, there's a lot going on. First topic this week. Looks like a compromise has emerged in the state Senate, and it may marry medical malpractice caps with wrongful death expansions. Now, what would that marrying of those two things look like?
Yeah, it's something that we've been working on, and the bill sponsor over on the Senate side, Senator Yarbrough, deserves a ton of credit just for trying to thread this needle. It's a complicated issue, and he's trying to drive compromise to make sure that we balance the interests of, protecting those who have been harmed in wrongful death situations that currently are prohibited by the statutes for suing, once they reach a certain age, sort of an arbitrary age in the statutes. And as there's growing momentum to eliminate that prohibition on suing if you're 25 or older, adult, if you're an adult child or parents of an adult child over 25, currently the statutes say you cannot sue for wrongful death. What he's trying to do is walk that fine line of giving those folks the ability to seek recourse in court, at the same time not to decimate healthcare delivery in the state by adding thousands, potentially it's an unknown number actually, of new litigants into the tort system and potentially suing many of the physicians out of the practice of medicine, or creating a more of an impact on our healthcare workforce here in the state, by having that pool of litigants just expanded without some other countermeasure. So the countermeasure is reintroducing the caps on non-economic damages for all medical malpractice cases in the state, and that would again give those folks that have been harmed the ability to go to court to seek redress, but also cap the non-economic damages that they could go after for pain and suffering. Again, the caps would only apply to non-economic damages. It would not impact their ability to collect everything on economic damages, like their future healthcare bills and lost wages and stuff like that. So he did a great job shepherding this compromise through the committee. There was a ton of testimony. If you've never sat through a tort hearing in Tallahassee, it's not a good experience, because you do hear a lot of heartbreaking stories about families that have been impacted by medical malpractice, and it's tough for the legislators to sit there and hear those stories, and then also look at the bigger question of how we find balance between giving them access to courts yet protecting access to healthcare. So they walk a tightrope there. The bill did advance out of committee, and they did add the amendment Senator Yarbrough offered that would provide the caps. So now moving forward, it's got two more stops on the Senate side. And the House version, currently there's two bills filed on the House side. Neither one of them have the caps on damages included. So it's uncertain the future of this bill here as we wind through session. But from an organized medicine standpoint, certainly we support Senator Yarbrough's efforts to try and land this plane in a way that's going to provide balance, so we don't see more physicians priced out of malpractice insurance here in the state. And again, have a deterrent for people to move here if our liability climate gets even worse. So a lot to go on that bill. It was great to see the effort from the Senate Judiciary Committee to find that compromise, and hopefully we can continue to push that forward.
Yeah, like you said, that was a pretty. I watched some of that testimony myself, and it was some pretty heavy stuff. pretty serious topic there. But we'll keep an eye on that as it moves forward, and give updates every week, and keep everybody in the loop on that. Fraser, second topic: increased access to care for injured workers may be on the horizon as workers' compensation reform moves forward now over there in Tallahassee. What's that all about?
Yeah, so there's the last time the Florida legislature really looked at workers' comp reform was back in 2003. So it's been 20 years since that time. Premiums, the reforms they put in place back then have worked. So premiums have gone down for businesses almost 80% in the state, which is great. But since the legislature has not addressed reform of that system, in 20 years, the fee schedule for workers' comp for physicians is established in the statute. So that hasn't changed either in 20 years. So now Florida physicians are reimbursed the lowest in the country for treating injured workers. And we're seeing a real access to care issue. There's some data out there that shows that Florida physicians participate in the lowest rates in the country in the workers' comp system. There's a separate bill running that makes sure first responders have access to medical specialists and increases reimbursement for those specialists to make sure they can get in and be seen. And then there's another bill, which is the bill that organized medicine has been primarily pushing, that Senator Jennifer Bradley and Representative Dan Daly have in their respective chambers. That will just increase the reimbursement for physicians across the board to 200% of Medicare. You're getting a lot of testimony from legislators that they have constituents who have been caught up in this lack of access to care as injured workers. You're getting some good testimony we've had from physicians that have come up to express their patients and how they struggle to find not just the initial service, but also other physicians that can help in a care coordination standpoint, since many doctors have just opted out of workers' comp. So the bill is moving forward. Great progress this week for it to pass both committees. So far, it's cleared 3 committees, and out of those 3 committees, all votes have been unanimous in support. So that's 35 yes votes in aggregate to no 0 no votes. So that's a good sign that there's broad acceptance that something needs to be done. We have not seen any real opponents of the bills emerge. I think just the one question is how much of a premium increase the legislature is comfortable with passing on to the business community. Having said that, premiums for work comp went down this year in Florida 15%. And it's projected that this increase, if they fund the full 200% of Medicare increase for physicians, would increase premiums 7%. So it still would be less than the savings they're getting this year. So we think there's an appetite to get something done this year. We think the decreasing premiums gives us an avenue to get that done. Without having a negative impact on the business community. I should say on the House side, in order to get the bill moving, we did have to agree to an amendment to lower the increase in reimbursement to 150% of Medicare across the board. But the Senate bill still is at 200%. So we're hoping that we can revisit that amendment in future committee stops and see if we can get them married up there again at 200% before the bill goes to the floor of both chambers.
And it's some of these things we talk about. It's really a marathon, but counting up all those yes votes, it's kind of like a ball game. We're kind of watching it as it goes, and all those yeses and not getting any no's so far. That's progress.
Yeah.
Final
And
topic this week, Fraser. When it comes to where to go for help, the state is looking at insurance dispute resolution mechanisms for patients and physicians. What's the latest with that this week?
yes, so there's bills moving in both chambers that would address or provide more tools for patients and physicians to actually address concerns they have with their health insurance coverage as they try and either utilize their insurance benefit or if they're getting reimbursed for delivering services and there's a dispute over what reasonable reimbursement would be. So the bill does 2 primary things. First, for all health insurance cards for patients, on the back of it, it would have a QR code that would take you right to the Department of Financial Services website where patients can seek help from the state in utilizing their insurance benefit. So whether they're having issues getting prior authorization for treatment, or if it is a reimbursement or copay or financial responsibility concern they're having, they can utilize that website to seek help from the insurance regulators. That website's been up and running for years, but not many people know where it is, so no complaints come in. So the state only gets a handful of complaints every year, but everybody knows you probably have personal stories of the trouble you have using your own health insurance benefit, and certainly our doctors see it every day. There are struggles going on, but we think the patients just don't know where to go to seek help. So this would make it easy. QR code on the back of your insurance card. You can just scan it, go right to the state, and the state is getting resolution of those issues within 48 hours. Typically, that's their average. So it's a huge resource. It's just underutilized. So we hope that part of the bill will make it easy for patients to do that. The second part of the bill deals with the surprise medical bills legislation that was passed several years ago that took patients out of the middle of disputes about reimbursement between hospitals and physicians and insurance companies when there is no contract in place. So usually this is out-of-network care where the health insurance company wants to pay you what they think is reasonable, and physicians often dispute their definition of reasonable. So the trade-off in that surprise medical bills legislation was that the state would create this dispute resolution system that both parties would go to, and a third-party independent panel would say, this is what the usual reasonable reimbursement is in the community, and would help arbitrate those decisions. So that system was put in place when the bill passed. The health insurers have decided that process is optional, not mandatory. So after the first number of claims went through that dispute resolution process, the insurers weren't happy with the outcomes, so they decided it's optional and they walked away. So currently we have a dispute resolution process that is not functional. The state has actually lost their contract with the contractor they had, Maximus, because there was no claims coming through. So they're like, this is a contract that's not working for either side. So they've walked away too. So clearly there's a problem, and this bill would just make it clear that the intent of the legislature was that we had a functional dispute resolution process and would require both parties to participate in it once a legitimate claim is put through dispute resolution. So we think both measures are very pro-consumer, and we're hoping that they will get moving. The bill moved through its second committee on the House side this week, so it's got a little bit of momentum. Hopefully we can get a little bit more progress over on the Senate and march this thing towards the floor as well.
Well, it's really interesting that first part you talked about there. The tools are out there, but people don't know where to find them. It's 2024. You think about 20, 30 years ago, waiting in lines and trying to get some progress. Now you can put QR codes on things and make things a little bit easier to track and to find. But that's those are three pretty big topics, and obviously a lot's been happening over the first 3 weeks over there in Tallahassee. Anything else that the physicians need to know about in the state?
I think for this week, those were the big items that were happening. Next week, they start to dive deep into the budget. So the budget proposals were released this week as well for both the House and Senate. The governor's budget's been out for a while, but that's where they're going to divvy up all of the revenue from the state for the various programs. Healthcare, of course, is a huge component of the state budget. So we'll be looking at that budget on the health side to see what funding is put in there. A lot of the Senate's Live Healthy funding that's already passed will be included in the budget, which increases GME and loan forgiveness for docs. So there's a lot to watch on the budget discussion. So we'll be doing that next week, and look forward to giving our members a bit of an update there from the end of week 4 next Friday.
Yeah, it sounds like we'll be talking numbers next week, but that's I mean very important stuff. Everybody's probably excited to kind of hear where the money's going.
Absolutely. And I'm no good at math, Joe, so you're going to have to hold me accountable as we start reporting numbers next week.
Yeah, I'll bring 2 calculators next week, and we'll just make sure we have everything correct. We'll break it all down for everybody.
Perfect. Well,
All right,
great.
Fraser. Well, it was a pleasure talking to you again this week, and I'm glad that the weather was a little better there for the trip this week compared to last week when it was pretty cold.
Oh yeah, it warmed up nicely. So hopefully the next couple of weeks when we're back up there, things will stay the same.
Excellent, excellent. All right, Fraser. Well, I look forward to talking to you next week, and we'll talk about those budget numbers.
All right. Sounds great, Joe. Thanks.